Thank you, Mr. Chairman. I move to strike the last word.
Gentleman is recognized.
Thank you, Mr. Chairman. I want to speak briefly to express my strong support for all three bills we have on today's agenda that reauthorize critical Alzheimer's care and research programs on the federal level. Sadly, Alzheimer's is the seventh leading cause of death in the U.S. Today, in my home state of Florida, the number of cases is expected to grow by over 24%, with an estimated 720,000 individuals living with Alzheimer's. Without a cure, the impact of Alzheimer's will continue to rise, and the number in Florida and across the country will escalate as a result of an aging population. This disease does not discriminate, and I'm sure we all have someone or know someone whose family has been affected by Alzheimer's. For me, it's very personal, as my mom has been afflicted by this horrific disease. We must continue our all-of-government approach in the fight against Alzheimer's, and I'm grateful our committee is focusing, thank you, Mr. Chairman, for all you do as well on this issue, but we're focusing on efforts, and these good bills we're moving forward to find a cure. Over a decade ago, we passed the National Alzheimer's Project Act to establish a federal strategic plan to address Alzheimer's and coordinate our federal programs into finding treatments and supporting caregivers to advance care, and we need it, advanced care for Alzheimer's patients. Since then, we have made a tremendous amount of progress and have channeled these efforts into new research and development in the private sector, into new treatment options. And we now have drugs on the market that target early onset Alzheimer's to slow the progression of this disease. Progress is being made. H.R. 619, the NAPA Reauthorization Act, which we just voted on, this is a strategic plan. It updates the current advisory council to include additional stakeholders, add new goals to reduce risk factors, and regularly update Congress on its efforts. Furthermore, H.R. 620, the Alzheimer's Accountability and Investment Act, will extend NIH's ability to submit annual Alzheimer's research budget proposal to the Congress so we can fully pursue scientific and biomedical research and opportunities nationwide. Lastly, H.R. 7218, the Bold Infrastructure for Alzheimer's Act, reauthorizes critical public infrastructure programs at the state and federal levels to ensure we remain committed to supporting families and caregivers and improving brain health for patients across the country. I'm grateful again for Chair Guthrie's efforts to reauthorize the Bold Infrastructure Program and was proud to co-sponsor H.R. 7218. I also want to recognize the leadership of my good friend Chris Smith and my good friend Paul Tonko. We work on many issues, including Parkinson's, together. And I want to thank them for their tireless efforts on these particular bills. I ask that my colleagues support the three Alzheimer's focused bills on the agenda today, and I yield back, Mr. Chairman.